Hello everyone. Well, I was sick for the last couple of weeks. And while I was sick, I learned something interesting that I didn't know about the Japanese healthcare system that I thought I'd share with you. As you know, Japan has a nationalized healthcare system. It's a very good system. It's very easy to get healthcare at a good, affordable price. I have no complaints about healthcare here. And what happened was that was very interesting to me was that I was very sick, and my wife took me to the clinic. And there are only 2 or 3 adult clinics here in our community, and all 3 of those clinics are packed all the time. Whenever they're open, you can't get a place to park, you can't get a place to sit. Although they serve you, they take care of you pretty quickly. It's just really a mess. It's really packed. We don't have enough doctors in this community. And my wife told me that as we were leaving for the clinic, she said, "There's a new clinic. We have a new doctor in the town." I go, great, maybe this will help relieve some of the load. She said, "Should we go give it a try?" I said, "Sure, let's do it." So we drove over to this place, and it really is a brand new clinic, brand new doctor in the area, and the place is beautiful. I mean, a really, really nice building, big parking lot, plenty of parking. We pull in, and there's not a single car there. So we park, we go inside, and there's not a single patient there. There's nobody there except the 2 women behind the counter. We give them our paperwork and sit down, and I kind of lean over to my wife, and I say, "What's going on? Why are there no patients here?" And she said, "Oh," he says, "that's the way it works in Japan." She said, in Japan, she said, "This particular doctor is from another part of the prefecture. Prefecture is the state. He's from another part of the prefecture. He has no local, he has no background in this community. He's not from the city of Shizuoka." I said, "Why does that matter?" She said, "Well, in Japan, it's all about, at the clinic level, it's all about the doctor's affiliation with the hospital." She said, "This is how it works. After a young doctor, finishes medical school, they begin their residency at a hospital. And the hospital that they choose is very important. The hospital that they get accepted into is very important. That's going to really determine, in large measure, the rest of their career. This is because if they're able to one day open their own clinic, they will then be able to refer patients from their clinic to that particular hospital. Having served their residency at that hospital, they then have an inside track on getting their patients into that hospital. The better the hospital, the better the client base that the doctor can have when they become a private, whoa, scary bridge. Better the client base they can have when they become a private doctor. So, this particular doctor that I was visiting was from another part of the state and had no past association with a particular hospital. Therefore, there were no patients anywhere. Well, this was news to me. I had no idea about this. I didn't know why this doctor chose to open up in this community, but there you go. So anyway, I get admitted into the clinic, and they decided to give me an IV and lay me down in a bed and put a little thing in me, and I'm laying there taking my IV for an hour or so, and finally another patient comes in, and that patient, a woman, she gets admitted into the same large room for a procedure as well, and she's sitting with the nurse next to me. There's a curtain, and I can hear them talking, and at one moment when the opportunity arose, the woman leans over to the nurse. I can actually see them in the reflection, and says, "So tell me, what hospital is this doctor associated with?" And I'm like, "Oh," I'm nodding my head. "Ah, naruhodo, I see. That's the key point." Now this point really does, one last thing about this subject. This point really does make a difference in Japan. In January, both my daughter and I were sick, and we had basically a version of the same illness. And I was admitted, my doctor sent me to the prefectural hospital, basically the big hospital for Shizuoka, probably the best hospital in our area. And it was amazing. State-of-the-art facility, state-of-the-art treatment, outstanding doctors. Whoa, big spider in the face. Everyone spoke English. It was amazing. I've never had an experience like that. My daughter, after a week after I was released, my daughter got sick. She was sent to her doctor, had an association with just a little regional hospital. She was sent to that hospital, and the treatment was good, the doctors were good, but I'm telling you, Everything else was different. The place was spooky. There wasn't even enough room for Emily's just a little girl, and she was put into a ward with basically all the dying people. She was surrounded all by herself for nearly a week by beds full of people that were dying, and the room was dingy and dark and all kinds of stains on the wall. It wasn't dirty, but it wasn't nice. And it really dawned on me that after my wife explained how the system works, how the association that you have, the doctor's association with the hospital, really is a key point to the Japanese, and I understand why. You want to have a doctor that did his or her internship in the best hospital in your area. If you can have that, then when it gets time to get really sick, you're going to wind up in the best hospital in the area. And basically all things are the same in terms of cost with the nationalized system. So that's how it works here in Japan. Sorry for this long ramble. I hope that this opens provides some additional information about the system here in Japan. For me, time to get on to my hike. Doesn't this trail look inviting? Let's go find out where it goes. Bye-bye.